I want to talk to you today about what universal health care really is and why we need it. Today, or yesterday, I called the doctor up, told him that the acid reflux medicines that I'm normally on have quit working. That happens. Sometimes Nexium will work for a while, then it quits. You're only supposed to take them 14 days at a time anyway. So what you do if it's really severe is you change whatever medicine you're on. So I called the doctor, and there is a medicine called Dexilent. It works very well with me, but it's expensive. But recently I've managed to get on Obamacare. The doctor's office did it for me as a favor. However, I'm not happy with Obamacare. I don't believe we should be forced to buy health insurance. But I'm having to take care of my mother. So things are a little tight right now. Plus I'm running for Senate. I decided to do it. To make a long story short, the very reason why I'm against having to buy health insurance is you have a middleman that decides your health care. Okay? By what they're willing to pay for or not. Now first of all, Dexilent, which is just a heartburn medicine, it's an acid reflux medicine, is already insanely priced here in the United States. When I called to pick it up, they told me the price was $290 for a month supply. So then I said, well look, I've got insurance. I've got Midwise insurance. Okay, well they told me to go bring the card in and they will put my insurance on record and see how much it would be. So I go trotting off to Walmart, and I give them my card after waiting in line forever, and they tell me that Midwise will not pay for Dexilent. Instead, they gave me a list of what Midwise will pay for. Prilosec, over the counter by the way, Prevacid, over the counter by the way, and a drug named Protonix, which I'm trying to look up now and I'm finding iffy information on. The thing is, I've already tried it. If you look, this is Prilosec. I don't even have the package anymore. I tried this months ago. It didn't work. Here's Prevacid. Now Prevacid does work on me. It does work. But I've already been through the 14-day supply, and it started to quit working towards the end of the 14 days. This is insane. Okay? This is why we don't need a middleman. All the insurance companies do is take your money that you pay in and divvy it up. As for you medical care providers out there and the drug companies out there, how do you like it not being able to sell your drugs because the insurance companies won't pay for them? And what about you? You're a doctor. How do you feel about being regulated on how much you can charge because of an insurance company? If we had universal health care, what that means, it's not socialism, it just means our tax money goes into our health care, just like it does our fire departments and our police. Because it's about life and death. It's about maintaining good health. If you have a third party come in, all they're doing is looking to make profits for themselves. And then they begin to dictate what kind of medical care you can get. Now, you think, well, that's socialism and it's going to raise our taxes. For most of us, health insurance is anywhere between $50 and $100 or even $500 a month, depending on what the deductible is. That's insane. Okay? If you're paying that and you get sick, then you run into what I ran into today, or you go to the doctor and you've got to still pay a $5,000 to $10,000 deductible, which means the first $5,000 or $10,000 of your medical bill comes out of your pocket anyway. So at the end of that month, you've got a medical bill to pay and your insurance premium at the same time. Okay, that's insane. Universal health care, we add some money to the price of gas. We add some money to the price of booze and cigarettes. People will still buy it, even if it's bad for them. Even add food and beverage tax. Right now here in Indiana, Marion County and the surrounding counties are paying a food and beverage tax to support a football stadium for a professional football team to play in. We're paying taxes to support the rich. Now what's wrong with paying taxes to support our health care? It would actually be cheaper. And the money that you're spending on health insurance, you'll just spend on taxes. When you go to the doctor, you'll probably have a $50 to $200 copay. And that's it. No matter what drug you need to be on, it's going to be made available to you. No matter what surgery you need. Something that you just get cancer and there's something they can do to stop it ahead of time, you can get it right away. The one thing that prevents people from going to the doctor is the money. A lot of people are dying needlessly because they just are afraid to go. We've got to get rid of this system. And I don't care what the insurance companies think. You can already make your money up on home and auto insurance. Airplanes, boats, and property. You need to get out and butt out of our health care because you're putting my health and everybody else's health at risk by you being the ones to decide what kind of treatments or medicines we can pay for.